Hello, everyone. It's Dr. Tom Workup again from the Black Island Medical Center. Today is April 14th, 2021. It's also Pandemic Day 401. Let's start off with some terrific positivity rates in the region. Rhode Island has gone from a 3.5% 7-day average down to 2.4%. That's terrific work. Our New England partners show a Connecticut rate of 3.37%, and Massachusetts is down to 2.4%. So doing very well as a region. Please keep up the great work. Unfortunately, there are 132 people in the state of Rhode Island that do have coronavirus, but that's significantly down from our peak in December of 514 people. Unfortunately, there are also 27 people that are on ventilators, so our prayers are out for them and their families. There are 708,000 dosages of vaccine that have been distributed to Rhode Island. There are 309,622 people as of yesterday that have been vaccinated fully, which is 31% of our population. That's a terrific feat. Keep up the great work. Some good news on the pediatric front. A recent study from the Washington University School of Medicine shows that vaccinated nursing mothers may pass on protective anti-coronavirus antibodies to their babies through breast milk, at least for 80 days after being vaccinated. So that's terrific news for new parents and for those that choose to breastfeed their children. A study published in the New England Journal of Medicine showed that both for the UK variant and the South African variant, that one dose of vaccine substantially increases the neutralizing activity of all variants. And that is terrific news for the Moderna vaccine recipients like the ones here on the island. The federal data shows that the UK or the British 117 variant is now the far most common version of COVID-19 in the United States, and the Moderna vaccine and Pfizer have held up terrifically. From a vaccine update, you're going to see a bit of a pause. The US government's going to slow down the J&J to 800,000 dosages this week, down from the 5 million they had prepared to distribute. So you might see a bit of a delay in getting vaccinations. But more importantly, they're recommending the pause because of the serious issues with blood clots. But here's what we know about the J&J vaccine, and here's what the CDC would like you to take into consideration. Of the 6.85 million J&J vaccines that have been given, 6 people have experienced serious blood clots. That's less than 1 chance in a million. They also want to keep in perspective that if you have a 1 chance of a million with the J&J, we have a chance of 1 in 500,000 of being struck by lightning. Just keep that in mind as you make your decisions. 6 patients have all been women between the ages of 18 to 48, so we're not sure if there's a biological or a hormonal component. We're studying that now. All 6 of these women that experienced the cerebral venous clots had thrombocytopenia, which is low platelets. This is something that we would find with a common CBC test that we can do here at the office and send off. They also experienced these symptoms between days 6 and 13 of being vaccinated. So if you have shortness of breath, swelling in your legs, have lost vision in your eye, or have a severe headache, and you're in that range, please give us a call for further guidance. But there have been no reported cases of this blood clot with either Moderna or Pfizer. So that's great news again for us. And of the 31,500 dosages that have been given in the state of Rhode Island, there has not been one serious blood clot reported. Some of the vaccination reporting structures show that women are reporting more than men. That's not unusual. And most have been reporting headaches, fatigue, and dizziness. And many of them have been reported that Moderna arm that we've all heard so much about with the itchy red rash at the injection site, which will continue to improve over time. More locally, some of the communities in Rhode Island, like Woonsocket, East Providence, Johnston, are going to open up on Monday for all members 40 to 49 years of age to be eligible. Boston Marathon runners in October 11th are going to have to show 2 negative coronavirus tests prior to being able to run. Something that may affect us here is that Connecticut is planning to provide full access this summer to its outdoor recreation areas, including state parks, boat ramps, campgrounds, shoreline beaches, and swimming spots. So that may trickle into our community as well. We're seeing an increase in coronavirus outbreaks in those aged 20 to 29. They're up 47%, and 30 to 39 are up 43%. So between 20 and 40, please get vaccinated, wear your mask, socially distance, wash your hands. Please be mindful. Remember, Rhode Island residents can go to www.vaccinateri.org. That's www.vaccinateri.org. And if you don't have internet access, please call 844-930-1779. 844-930-1779 to get assistance with signing up. Remember that they will be identifying people by age and by zip code. So please sign up to be vaccinated. 25 vaccines will be given each Thursday by the DMAT team. Again, 25 vaccines each Thursday. Please sign up at the vaccinateri.org. In terrific news, the clinical trials that had Pfizer and Moderna at about 95 and 94% effective and Johnson & Johnson at 66% have come back with new data that Moderna has prevented serious illness 100% of the time in its trials to date. And Pfizer is now at 90% and Johnson & Johnson is up to 85%. So it looks tremendously positive for us that we've gotten the Moderna vaccine. On a separate health-related issue, the Block Island Medical Center is proud to now be partnering with the Women's Cancer Screening Program. This is a program that the state has had for a while for underinsured and uninsured women ages 20 to greater than 65. It provides for free pap smears, free mammographies, free exams, and if there are issues that develop as a result of these screenings, there are finances available for that. So if you have any questions, please call us, speak to Greta or those at the front desk to get you some more information. We're starting to open up. We're starting to make changes here in the office, getting ready for the summer season. We're encouraging everybody to get their preventative annual wellness visits completed by the end of May. If not, we'll restart again in September. The flavor for the medical environment changes for us through the peak summer months, but the weather is getting nice. Please get out there and exercise. Please enjoy the sunshine. Remember, if you're exercising alone, you don't have to wear a mask. And when you are in close proximity, please wear a mask or socially distance, wash your hands, and be mindful. If you have any questions, please give us a call. If you like receiving information like this through YouTube, please hit the subscribe button and you'll be notified when we have new information out available to you. Have a great day, and I'll talk to you soon.